Hello everyone, my name is Dr Ihere Peter of the Department of Community Medicine here in UNTH Enugu. You're welcome to yet another exciting episode of the UNTH Health Education Series. Today we'll be looking at a very interesting topic that goes by the name diabetes mellitus, popularly known as diabetes or oil sugar in the Igbo parlance. What exactly is diabetes mellitus? Diabetes mellitus refers to a group of diseases that affects how the body makes use of sugar, more specifically glucose. Now, glucose, as we all know, is a very important fuel that fuels the entire cells in the human body and the tissues at large, especially our muscles. And more importantly, the brain makes use of glucose as its primary source of fuel. So now, what happens when we begin to talk about diabetes? We talk about elevated blood sugar levels of glucose. Now, that is what we do not want, and that is the reason for our discussion today. We have causes of diabetes mellitus which vary from the different types of diabetes mellitus. However, the essential factor in all the types boils down to excessive blood sugar in the system. So what are the types of diabetes mellitus? There are three major classes of diabetes mellitus. We have type 1 diabetes mellitus, type 2 diabetes mellitus, and then gestational diabetes mellitus, GDM. Type 1 diabetes mellitus essentially is also known as the insulin-dependent diabetes mellitus or the juvenile onset diabetes mellitus, while type 2 is known as the non-insulin dependent diabetes mellitus or the adult onset diabetes mellitus. Now, type 1 diabetes mellitus here, the causes are not quite clear to many scientific researchers and people. However, it has been noted that there are genetic and environmental components to this particular type 1 disease or diabetes mellitus. So for the type 2 type, the causes has been attributed to different risk factors, which we'll look further down. However, the gestational diabetes mellitus talks about how blood sugar levels are elevated in pregnant women, and then this could also resolve after the baby. This may or may not be resolved after the baby has been born. So, the risk factors, generally speaking. The risk factors for type 2 diabetes mellitus are quite a number. But then we'll look at risk factors such as age. It has been known and shown that age has a way of affecting the onset of type 2 diabetes mellitus. An increase in age from the age of 40 and above, we begin to see the likelihood of developing type 2 diabetes mellitus, especially in those who have a familial history. So, but however, it has also been shown that even those that are younger are beginning to develop the type 2 type of diabetes mellitus. Another factor here is the sex. Another factor here is the race. Blacks, it has been shown that blacks are more prone to developing type 2 diabetes mellitus alongside the American Indians and then the Asian Americans for reasons that are not yet too clear to us. Yes. We also have issues such as family history. Those who have family history, either a parent or both parents or a sibling or more siblings who have developed type 2 diabetes mellitus have a higher chance or likelihood of developing the disease. Also, we've also seen cases where people with hypertension also develop type 2 diabetes mellitus. Those with polycystic ovarian syndrome and some other disease conditions also have been attributed as risk factors for the development of this disease. So what are the symptoms that we see in type 2 diabetes mellitus? The symptoms are essentially, these are the things that you want to look out for when you begin to suspect that you have type 2 diabetes mellitus. This would include increased thirst. And this is because of the increased thirst, which will lead to increased drinking of water, which is what we call polydipsia. You begin to drink water excessively. Now, apart from that, you begin to experience excessive hunger. Why? Because these cells are not getting this glucose. So your body tends to want to eat even more and more food to compensate. Even amidst this excessive hunger, you begin to notice significant weight loss despite this excessive eating. This is another major symptom too. Other symptoms will also include things like irritability, fatigue, alongside other things that could also crop up before it begins to progress even to the severe stages. Okay, the reason for this talk is for us to identify these symptoms such that when they begin to present, we know exactly when to present to our doctor or to see a physician that is nearby. So what are the preventive measures we have for this particular group of diseases that affect how the body handles sugar, specifically glucose? We want to look at things like dieting. You begin to watch your diet. You reduce high-calorie diets and take more fibers, more fruits and vegetables. reduce fatty foods, and take more fruits, vegetables. These are the things that will also help to curb or reduce the progression of this disease. You also want to look at things like exercising. Inactivity, like we discussed, has been shown to be a major cause of developing type 2 diabetes mellitus. So enhanced activities such as exercises can help to reduce or limit the progression of this disease. So having spoken for this length, when exactly are we supposed to see the doctor or present to the hospital? Like we already listed earlier, when you begin to notice any of these symptoms, once you are 45 years old or older, you want to begin to have regular visits to your doctor to check your blood sugar level at least 3 times a year. Once you notice that you get diabetes mellitus when you're pregnant, that's also a risk factor for developing type 2 diabetes mellitus. Also, when you begin to eat too much and at the same time lose so much weight, when you begin to you have frequent urination and you begin to drink water excessively, when you begin to notice some of these changes, and when you also have a family history, very important because most people tend to forget this. So when you have a family history of type 2 diabetes mellitus, your chances of developing this disease is also increased. So you want to see a doctor even frequently so that you can be able to have adequate attention. Having said all of this, if you have more questions or inquiries, you could also dial or reach out to the number on your screen. We will be ready to listen to you and attend to whatever questions you have. All right, so I want to thank you very much for listening. I remain Dr. Ihere Peter from the Department of Community Medicine, UNTH. I just presented a topic on diabetes mellitus. Thank you and God bless you.